Pelvic pain, unusual discharge, bleeding after sex, or pain during sex can feel frightening. And for a lot of women, it can also feel confusing. You might wonder, is this just thrush, or a UTI, or hormones, or stress, or something you should ignore and hope goes away? One condition that deserves clear attention is pelvic inflammatory disease, usually shortened to PID. PID is an infection of the female reproductive organs. And it matters because if treatment is delayed, it can sometimes lead to longer-term problems, including chronic pelvic pain, a higher risk of ectopic pregnancy, and fertility issues. In this video, we're going to break PID down in a practical way. What it is, what symptoms can look like, why it can be missed, how it's treated in the UK, what can reduce your risk, and when symptoms are urgent. And just to be clear, this isn't about shame. PID is common, it's treatable, and it's nothing to be embarrassed about. The goal is early recognition and proper treatment. PID usually starts when an infection spreads upwards from the vagina or cervix into the womb, the fallopian tubes, and sometimes the surrounding pelvic tissues. It's often linked to sexually transmitted infections, especially chlamydia and gonorrhea, but it can also be caused by other bacteria. PID can be mild or it can be severe. And here's the tricky part. Some people have PID with only subtle symptoms, which means it can cause inflammation and scarring before anyone realizes what's happening. When scarring affects the fallopian tubes, it can interfere with how an egg travels. That's one reason PID can be linked to infertility and ectopic pregnancy. PID symptoms can vary a lot. Some women feel very unwell, others have mild discomfort that's easy to brush off. Symptoms can include lower abdominal or pelvic pain, which is often the main one, pain during sex, especially deeper pain, unusual vaginal discharge, meaning a change in color, smell, or amount, bleeding between periods, bleeding after sex, painful urination sometimes, heavier periods or changes in your cycle, and fever or feeling generally unwell, which is more common in more severe cases. Because these symptoms overlap with UTIs, ovarian cysts, endometriosis, and bowel issues, PID can be misread or delayed. A key message is, if pelvic pain is new, persistent, or getting worse, it deserves proper assessment, not just reassurance. Not everyone with PID develops complications. Many women recover fully with antibiotics. But PID matters because the longer it goes untreated, the higher the risk of scarring. Possible complications include fertility problems, especially if the fallopian tubes are scarred. A higher risk of ectopic pregnancy, which is when a pregnancy implants outside the womb, often in a tube, chronic pelvic pain, and in some cases, a tubo-ovarian abscess, which is a serious collection of infection that may need hospital care. This is why clinicians often treat PID based on suspicion. If PID seems likely, antibiotics may be started before every test result is back, because every treatment protects future health. PID happens when bacteria enter and spread through the reproductive tract. A common route is untreated or undiagnosed chlamydia or gonorrhea, but PID isn't limited to those. Risk can be higher if you're under 25 and sexually active, because STIs are more common in this age group. If you've got a new sexual partner or multiple partners, if condoms aren't used consistently, if you've had PID before or a history of STIs, or if your partner has symptoms or an STI diagnosis. And I want to say this clearly, PID isn't a moral judgment, it's an infection risk linked to bacteria exposure. Shame delays care and delay is what causes harm. A lot of women are used to managing thrush or BV, so they self-treat first. And that makes sense. But PID can sit higher up in the reproductive tract and symptoms can overlap. Thrush usually causes itching and irritation, often with thick discharge. BV often causes a fishy smell and greyish discharge. UTIs often cause burning when you pee and urgency. PID can involve discharge changes too, but the bigger clues are often pelvic pain, deep pain during sex, and bleeding after sex or between periods, especially if there are STI risk factors. So if you keep treating infections, but pelvic pain keeps coming back, it's time to ask for a fuller assessment. PID diagnosis is usually based on a mix of your symptoms and history. A clinician may do a pelvic or internal examination to check for tenderness with your consent. They'll usually offer swabs or tests for STIs like chlamydia and gonorrhea. They may also do a urine test, a pregnancy test, and sometimes blood tests. An ultrasound might be used if the diagnosis isn't clear or if complications are suspected. And an important point, a negative STI test doesn't always fully rule out PID. Other bacteria can be involved and timing matters. PID is treated with antibiotics. Often it's a combination because treatment needs to cover the likely bacteria. The exact regimen can vary depending on local guidance and your individual situation. What matters most is starting treatment promptly if you're advised to. Finishing the full course, even if you feel better before it's done. Avoiding sex until treatment is completed and symptoms have resolved based on your clinician's advice. And your sexual partner or partners may also need testing and treatment to prevent reinfection. Reinfection is one reason PID can become a repeat cycle. So treatment isn't just about today's symptoms. It's about protecting fertility and reducing chronic pain risk. Some symptoms need urgent medical attention: severe lower abdominal pain, high fever, vomiting or not being able to keep fluids down, fainting or collapse, signs of pregnancy with pain or bleeding, because that could be an ectopic pregnancy or a worsening condition despite antibiotics. If you feel very unwell or the pain is severe, don't try to sleep it off. Get urgent help. Hearing that PID can affect fertility can feel scary. So here's the balanced truth. Many women who have PID don't become infertile. Risk tends to increase with delayed treatment, more severe infections, and repeat episodes. The goal of early treatment is to reduce inflammation and prevent scarring. If you've had PID and later struggle to conceive, it's reasonable to tell your GP early, so the fertility pathway considers tubal factors. And if you're being treated for PID now and you're worried, ask directly, what follow-up do I need and when should I come back if symptoms don't improve? Prevention here is practical, not moral. Things that reduce PID risk include regular STI testing if you've got new partners or relationship changes, using condoms consistently, especially with new partners, prompt treatment of STIs, making sure partners are treated to prevent reinfection, and going back for follow-up if symptoms don't settle. If you've avoided STI testing because you feel nervous or embarrassed, remember, clinicians do this every day. It's routine healthcare. If you suspect PID, you can say, I'm having pelvic pain and I'm worried about PID. Can we assess this urgently? Can we do STI testing and a pregnancy test today? Do I need antibiotics now or are we waiting for results? What symptoms mean I should seek urgent care? Do my partner or partners need testing or treatment? When should I come back if symptoms don't improve? And if you've had similar symptoms before, you can add, I've had this before. Could this be recurrent PID or could there be another cause of pelvic pain? PID isn't something to be ashamed of, it's something to treat early. If you've got pelvic pain, unusual discharge, bleeding after sex, or symptoms that don't feel right, you deserve a proper assessment. Your body isn't overreacting. Pain and bleeding are signals. Acting early can protect your fertility, reduce chronic pain risk, and help you feel like yourself again. And if pelvic pain has been a long-term issue and infections don't fully explain it, your next step may be understanding the difference between infection-related pain and conditions like endometriosis. Tap the thumbnail on your screen to watch our endometriosis guide, and it'll help you recognize patterns and know what to ask for next.